Hi there, everybody. So on today's topic, as you can see the title, kidney transplant. So I'm guessing you can guess what I'm talking about and why I'm talking about this particular subject. So if your guess is that I had a kidney transplant, then yes, that is the correct guess. I've had a kidney transplant a long time ago, 1993 to be precise, but because I suffer basically chronic renal failure, which led me to need this transplant. Obviously I had to have dialysis. I had dialysis for some time, luckily not long enough. At the time I was fairly young, I was 16 or so, and had to have dialysis 3 times a week. Try not to guess my age now, because otherwise I might feel a bit too old. But I had dialysis 3 times a week until obviously I was waiting for a transplant, a donor that I could have a kidney from. In the meantime, I had a few operations because I had dialysis via a catheter that was inserted to my neck. It was on this end, or it was from this end. I had a few, but then I had an operation to try and have a fistula. The fistula was meant to be done on my wrist. I still have the scar there, it's visible, but it didn't work. The fistula didn't actually work, so I had to keep with the catheter. But then I had another operation to have treatment via something called peritoneal dialysis, or a CAPD, where you get some fluid into your peritoneal area basically, and then you drain it. So I think it used to be half an hour. You used to go in half an hour and then you leave it there for 4 hours or so, and then you had to change it. It was 4 times a day, and you needed to have a tube inserted in your stomach area, and then you had to do that 4 times a day, and you needed to have a lot of room to have boxes. But it was a way of giving you some kind of freedom from having to go to hospital 3 times a week and being on a machine for 3 hours at a time. I wasn't particularly happy at the time anyway. I wasn't happy with it, because I was thinking, well, if I have this problem anyway at such a young age, then I hardly want to go anywhere. So I think I would rather go to the hospital and be on the dialysis machine. Because anyway, with the renal failure, you tend to be very tired, and you have to be on a very special diet, very low potassium, and so on and so on. Many people may know about this, many people may not know, but it's a difficult time to go through. It's not easy, and but I was lucky enough not to be on dialysis for too long, and a donor came along And I had I always remember the call I had. I had a call from St. Mary's Hospital saying there was a kidney available for me. And I was excited. But I was also scared and very anxious. I had no idea what was having a transplant or an operation of that kind was gonna be like. Not a clue. Plus, I never realized either that when I was told I had renal failure, I never realized that I would need a transplant. I always thought it was something that the doctors may give me some tablets and everything will be okay. I'll go back to normal. But that wasn't the case, as I found out through the years. So it has been a very long journey for me, very long. And if you got this far on my video, then you will find out that I actually had 2 transplants. And that is because my first transplant failed after probably 12 years. I think it was I had it for 12 years, but in those 12 years I had a lot of problems. I had rejection, and I needed a lot of treatment with steroids and iron infusions, lots of medication basically. But back in those days, the treatment was not as good as it is today. Possibly, I can say that. But although some people, for some people, it worked very well. But for me, it didn't. It didn't work that well. I was on steroids for a very, very long time. So maybe 15 years I was on steroids for. Every day, daily steroids. So I looked very differently back then. I may put a picture of how I looked through my university years. I managed to go to university, yes. I really wanted to do something, but nowadays I realize that going through university was very tough while I was with my first transplant, because I had so many rejections and things that I didn't cope very well. But I did finish it. And I got a degree on aeronautical or aerospace engineering, and I got a 2-2. Okay, not that great, but I believe I could have done a bit better had I been a bit better as well, health-wise. Through those 4 years, I spent a lot of time in hospital, going to hospital, and having treatments. And all through that time, I had to I had to really drive back and forth to uni. I couldn't actually stay at uni at halls of residence, because it was difficult. Plus, to be honest, I didn't qualify at the time. So the main problem I had with my first transplant is that as time went by and I had rejection, the kidney was also failing slowly failing. So if you know about creatinine, which is one of the levels we doctors use to check your kidney function, my creatinine was at the beginning wasn't too bad. It was about 140, I think, when I first had the transplant. But 5 years down the line, it was about 200, and 6, 7, 8 years after, it was on around 250, 280. But with that came another problem, and that problem was gout. I was developing a pretty bad gout because the transplant was not filtering the uric acid very well out of my body. So uric acid, or as is measured, urate, it's very it's the problem that causes gout. And believe it or not, by 2004, I think 2004, I had such a bad gout that I had a buildup of tophi on my joints, all my joints. My elbows had like golf balls. My hands were deformed, and tophi is basically a buildup of the uric acid on your joints, and it looks white, and it's not very nice. I had it pretty much all over my body. I had it on my knees, I had it on my wrists, little lumps here, hands, all the joints. Some fingers were worse than others, and that carried on for quite a long time, very long time. And I don't know if you know or you don't know, but the best thing for avoiding gout is not to eat red meats or drink alcohol. But in my case, obviously, it was whatever I ate. It didn't. A lot of foods will contain purines and uric acid and things. So if your kidneys are not working very well, it just won't filter out properly. And even if you're on an extreme diet, it still accumulates, unfortunately. So the thing is that to qualify, I basically needed a second transplant. And to qualify for a second transplant at the time, I think my kidney had to be at a 19%. I think, as far as I remember. But mine was still working at a 21% or something. It was still clearing my blood 21-22%. But if it went down to 19%, then I could qualify for a transplant. A second transplant, basically. But my kidney was working for a very long time at a just above that number, which caused a lot of problems to me, and as a result, I couldn't work. And I had an aerospace engineering degree. I applied for jobs even though I was that sick, but nobody would take me anyway. Questionnaires always ask, have you seen a doctor in the past year? And have I seen a doctor in the past year? Obviously I had seen like 1 million doctors in the past year. But I still was willing to work, to find some work, and to try and do something with my degree. But it didn't happen. In the end, I was very ill anyway. Even if I had got a job, I would probably would have had to leave, because I just wouldn't have been able to manage it. I was just extremely sick. So again, I needed another transplant. I was tired. I was basically really bad, and at that point, I also had chronic gout, and just could not use my joints. Were in so much pain. It was ridiculous and unbelievable. But I think I'm gonna carry on the next video, because this one is taking a little while now, and I don't want anybody to be too bored. So I will continue the story. If people are interested, I'm not sure, but if you are, follow my next video. And thank you for watching and listening to me. I really appreciate it. If you have any comments, do let me know.